I'm excited to be with you today to talk about cancer and cannabidiol. I want to review some of the extraordinary potential benefits of cannabidiol with respect to helping people with cancer as well as preventing cancer. There's a lot to be said on this particular topic, and there's a huge amount of literature that's there. I'd like to share some of that with you and some of my protocol for how to manage cancer with cannabidiol. First off, let's look at the burden of disease and some of the standard and conventional causes and treatment that is currently used in medical care. We'll look at the endocannabinoid deficiency and how it relates to cancer and cannabidiol. And then I'll give you some evidence for cannabidiol benefits in cancer. We'll talk about serving sizes and management with cannabidiol in cancer, and then I'll list off my references, and we'll have some time period for questions and answers. The burden of cancer is huge on this country. We're talking about 1,600,000 people who will be diagnosed with cancer during this coming year, 2017, and over 600,000 will be dying of cancer during that time period. The costs are listed at $158 billion, but I think that is a low estimate of what it actually is. There's an interesting phenomena that the leading cause of bankruptcy is actually related to medical care. The financial toxicity, as it was discussed in one particular article, was particularly telling in that it injures people, especially in the financial sector, forcing them into bankruptcy and having them to pay out of pocket, in spite of having insurance programs that are supposed to be covering them for most of their expenses. Unfortunately, that's not always the case. If we look at the pathways of disease when we're talking about cancer, they're very complex, and they are individualized per person as they are for the different types of cancers. And a cancer may manifest itself through different pathways with the use through different mechanisms as well. So everybody's familiar with the genetic, but actually genetic is a relatively seldom cause for cancer. So you don't look at that too far. We look at carcinogens. That's the major discussion that's going on. Is it in the food? Is it in the water? Is it the substances, the air that we breathe? We know, in fact, that many of these things are things like smoking, we know are definitely carcinogens, and yet people will smoke even in the face of that knowledge. There's also immunodeficiency. We know that well from examples where people have been put on immunodeficiency drugs or are immunodeficient because of some other condition, and they have very high rates of cancer. HIV is a classic immunodeficiency disorder where cancer is highly prevalent. And finally, there is inflammation. And inflammation chronically seems to lead to cancer. Enough stimulation that goes on, it seems to stimulate the immune system, but probably in the wrong way, and stimulates the cells that are in the body to react and to have growth spurts that are not the best for the organism and lead to cancer formation. If we look at the conventional treatment, these are things you're all familiar with: chemotherapy, radiation therapy, the immunology biologics, the injectable antibodies, as well as some of the injectable anti-cancer drugs that are there. These are commonly in practice and can cost huge amounts of money, as well as not be completely effective in their therapeutic area. But consistently, there has been a movement to develop what I call silver bullets, so that specific anti-biologic or antibody or anti-cancer drugs are being used that target individual cancers, and an individualized therapy for each person to look at what the defect is and how this individualized therapy can work on them. This is great for those individuals and where the financial costs are not really restraining, but for the rest of us, we're going to have to look at the general approach. And then finally, there's surgery. Removing the cancer is always the best idea in terms of getting it out of the body, but unfortunately, as we've seen with many cancers, they metastasize early and they distribute around the body so that years later they can come to manifest themselves as a recurrence with even more difficult challenges in terms of getting rid of those particular organisms. If we look at the endocannabinoid system as a cause or something that potentiates the cancer, we can see some common entities that are occurring. First off, there is very good evidence of a clinical endocannabinoid deficiency in almost every one of these cancers. And those that have not been identified, they haven't really been searched at this point. There's well over 200 different types of malignancies. Not all the testing has been done. And what is the significance? It's really hard to determine what that is. Consistently, there seems to be an elevation of the endocannabinoid receptor type 2 in many tumors, but that has a great deal of variation. Now, it may be at some point that we can use the cannabinoid receptors as markers for how to address different types of cancers with different chemotherapy agents, as well as using cannabinoid type of compounds. The reason I bring that up is because tamoxifen actually has an endocannabinoid function. It's working on the endocannabinoid receptor specifically. It also has other functions, but there's an interaction going on. There's an interaction that's going on specifically with tamoxifen. And Cytoxan is a very commonly used chemotherapy agent. It induces reactive oxygen species. These substances that are highly inflammatory and oxidative that can signal cell death for those cancer cells. And so Cytoxan is actually working on the same way that some of the cannabinoids work. And radiation, this is another thing that is being used to increase the reactive oxygen species, the oxidants within the cell that lead to cancer cell death. Unfortunately, these substances, these chemotherapy agents, apply to all cells, whether they're cancer cells or normal cells. And so that leaves normal cells at risk. And as a result, you do have the toxicity related to those chemotherapy agents. Now, when we're talking about cannabidiol's effect on cancer, I think we can categorize it in several different areas. And we're really talking about 4 different angles that cannabidiol is so helpful for in treating cancer. It doesn't necessarily, it's the final outcome in terms of does it destroy the cancer. Everybody's looking for that particular solution, but there are so many other ways that cannabidiol helps in cancer treatment, as I discuss here, in terms of destroying cancer on the one hand, defending the normal tissue against the cancer chemotherapy that's being used, supporting people when they're going through cancer therapy and during the course of cancer, as well as preventing recurrences of the cancer. These are all areas where cannabidiol is superbly acting on the body to really support the cancer patient. If we look at cannabidiol in the mechanisms that are involved with destroying cancer, they're really quite impressive. And I want to emphasize with this image of the intercontinental ballistic missile on the right, showing multiple targets. That's what you have to have for agents that kill cancer. They've got to work at several different levels because cancer is so slippery in terms of destroying it, getting rid of it. You've got to attack it from multiple angles in order to be successful. And that's what cannabidiol is doing. It's blocking cell growth and killing individual cancer cells. It's blocking the invasion, the spreading, and the metastasis of cancer cells. It's blocking new vasculature. So in order to support a cancer mass, it needs new blood supply always coming in. Cannabidiol is blocking that angiogenesis, which is commonly termed, but it's blocking that formation of vasculature, which is a key component in the development and promotion of cancer. Furthermore, it's blocking inflammation in the area. We already talked about inflammation being a precursor for cancer in many cases. Cannabidiol is probably the best anti-inflammatory agent that is available. It's stronger than what we see with vitamin E or with vitamin C. The effectiveness is quite substantial. So blocking the inflammation, it's stimulating immune attack. It sets the cancer cells up so they are more susceptible to killer T cells in terms of their action on and destroying the cancer cells individually. In addition, we're seeing cannabidiol enhancing the chemoradiation kill ability of those substances. We talked about before that they increase the reactive oxygenation species, and what is going on from there, cannabidiol prevents them from being rescued and enhances the kills for that particular mechanism. If you're looking at the selective cancer cell action for cannabidiol, we're seeing, again, a multi-dimensional target that is going on with cannabidiol. Cannabidiol is working at stimulating the self-eating or autophagy, as well as the self-suicide of cancer cells. So we're not talking about a huge attack on it that leaves decimation for other cells around. We're talking about the cancer cells going through a process of signaling their own death and demise through the stimulation of cannabidiol. Specifically, we're finding that cannabidiol also increases the reactive oxygen species. And so that triggers a number of cellular events that leads to the cell's self-destruction. Cannabidiol specifically works on the mitochondria for cancer cells, and it disables them. It becomes non-functional, which is facilitates that process of apoptosis where the cell dies. And cannabidiol is getting right down to the DNA, and it's blocking the ability of the cancer cells to form protective enzymes, to create barriers, and to prevent resistance to other types of chemotherapy agents. In addition, cannabidiol is working to block the rescue. It depletes the glutathione, which is a way that the cell uses to block the reactive oxygen species, to prevent itself from having to go through apoptosis and self-death. It's preventing the rescue by depleting the glutathione that is part of that rescue. So we talked about the way that cannabidiol is actually attacking the cell. But let's go on to show you how cannabidiol defends the normal cell, because that's something we don't always look at. And not everybody understands because the focus is all on the cancer cell. Let's look at the normal cell. We're seeing the prevention in normal cells. And so this is a very selective molecule. It's working differently in cancer cells versus normal cells. It's preventing the reactive oxygen species that occur in normal cells. It's stimulating the mitochondria to be more efficient, to create more antioxidants for the cell, to protect it. It's actually increasing the amount of glutathione that's in the cell to prevent the damages that can go on and to block any destruction within the cell. It's stimulating the repair at the DNA molecule. It's stimulating the repair of other mechanisms within the cell as well. It's preventing cell and organ damage. So we're talking about hypoxia and ischemia within the organ systems, whether it's the brain or the heart or the kidney. Cannabidiol is protecting those systems right down to the cellular level to prevent their damage and to improve their recovery. It's blocking chemoradiation injury to those normal cells. So you've got great protection going on for the normal tissues, and it's defending that normal situation. In addition, we're seeing cannabidiol supporting the individual who has cancer. relieving pain, reducing the nausea, and preventing the anxiety and the depression that goes hand in hand with this terrible and difficult diagnosis, as well as the chemotherapy and radiation therapy that's associated with it. It's improving sleep, and it's enhancing wound healing tremendously. You've got all of these advantages for using cannabidiol. So even if you're not getting a cure, you're not getting a total remission with cannabidiol, you're enhancing the ability of people who have cancer to live the remaining period of their life with as great a function and interaction with their family as possible. And finally, cannabidiol is preventing the recurrence of cancer. It may be recurrence or it may be cancer altogether, but it's very strong in the way that it's going to prevent cancer in those individuals who are particularly susceptible. It's stimulating normal cell repair. So it's preserving those cells, allowing them to repair and prevent the problems that come up with reactive oxygen species, with the areas of inflammation on around the cell as well as inside the cell. And it's stimulating immune defense, protecting the body against those abnormal cancer cells as they form, but as they form rather than after there's been a mass and a large density of cancer cells that may have formed within the body. And individually, those cancer cells that do form, the cannabidiol is inducing cell suicide for those cells, so to prevent the formation of cancer and formation of any particular mass. It's been said that it takes almost 10 years for a cancer cell, let's say a malignant breast cell, to become a 1 centimeter tumor. So this is a long-term process, and being able to work within the body and prevent this formation, especially for susceptible individuals, extremely valuable, and I think it's going to be life-preserving for so many people. Let's get on to treatment. I want to talk about my protocol and how I use cannabidiol and recommend it being used in cancer. Does it work in everybody? I can't guarantee that. I do have a number of successes, and I'll show you a few pictures of some of those remissions at the end of the presentation. Now, I usually like to start people with using 15 milligrams of cannabidiol on a twice daily basis, but to increase it as tolerated. The target goal is 90 milligrams. I've used higher doses, but I've consistently found that people have been successful when they have gotten on the order of about 90 milligrams. Higher doses were not particularly more effective, and 90 milligrams was what I considered a very solid and consistent result with that. In terms of what form, capsules, tinctures, the X-Pen, they're all very effective, shooting for that 90 milligrams. The duration of action is typically 12 hours, and so using it twice a day is a great way to go. It can certainly be divided up more than that, and there's some thought about using it once a day in order to capitalize on the inability of the cancer cell to rescue itself, and using that particular characteristic of cannabidiol. There's a couple more guides for cancer I'd like to talk about, because cancer is a slippery little devil, and you may need to use some other things. You need to apply some other things in order to make cannabidiol most effective. Stop the anti-inflammatories. So in cell cultures and in one study, there was evidence that using things like vitamin E or curcumin could block the inflammatory induction that cannabidiol causes within cancer cells. So making sure those are not available. There's no better anti-inflammatory than cannabidiol, so there's no reason to use any of these other substances, and they could interfere with the cancer destruction by rescuing the cancer cells and giving them the ability to recover from the reactive oxygen species and the inflammation within the cancer cells. And then one other thing that I'm finding is that using a CB2 receptor agonist can be very helpful. Now, the X-Pen has some of that CB2 agonism right located within it is part of that blend of entourage, the full blend of cannabinoids that comes with the X-Pen. But if that is not possible, caryophyllene has been shown to be a very effective CB2 cannabinoid receptor type 2 agonist and is easily available. So let's go over this a little bit and we'll recap here. We're talking about a huge burden of cancer, not only financially, but as well as for the suffering and the death rates that are involved. Endocannabinoid deficiency is common. There's a role here. We haven't defined it. It may be sometime in the future that we'll be able to use the measurements of cannabinoid receptors as an indicator for what therapy is going to be best in individuals. Now, cannabidiol addresses all of the pathways, or many of the pathways for cancer, and uses multiple pathways to destroy cancer and to prevent its recurrence. Cannabidiol is supported in numerous preclinical studies as well as in plenty of practice situations. I know from my experience, I have a number of remissions that are going on, and it's exciting to hear the stories about people who have gone into remission. There's no adverse effects, there's no toxicity or drug interactions that I see with cannabidiol, and no one has experienced any of these with cancer therapy. In fact, I recommend for all cancer patients that they go through the chemo and the radiation therapy that's recommended, and they use the cannabidiol for support because it prevents those noxious effects of the chemotherapy, at the same time enhancing the kill effect of those therapies. And so people can breeze through their chemo and radiation therapy with the best result. Dosing is modest and it's got fast results. And what I mean by fast results is I'm typically seeing remission signs within the first month of treatment. So that's the summary of what I have talked about with regard to cannabidiol for cancer. I've listed off and put my references, and I've put slides in the website that you see listed as the slides and references. You can go to there and have access to those slides, as well as to take a look at some of the references and even my protocol for cancer and using cannabidiol. It's been a great pleasure talking with you today on this important topic, and I'm really excited to be sharing this particular information. It's so important, and I think it has a great impact on the world with respect to the horrible and the difficult situation, the cancer that I know that touches all of our lives. Well, thank you very much for sharing this time with me, and it was a pleasure to talk with you. I do want to share a few of pictures of some of the people that I've worked with regard to cancer and that are now in remission. Mona on the left had stage 4 metastatic ovarian cancer. Paul is the latest success, I guess, is because I spoke with him yesterday, and his oncologist declared him in remission, that there was no sign of any cancer after his second, his follow-up CT scan, where there was no evidence of cancer at the present time. And then Joe is a gentleman with bladder cancer who's responded very well and is very enthusiastic about the benefits, the side benefits that he's getting from cannabidiol, as well as the anti-cancer effect.